Amid ever-growing patient demand and lengthening waiting lists, Scotland's public sector watchdog today declared that the delivery of NHS services must be reformed for our health service to be affordable and sustainable. Audit Scotland found that health boards are struggling to make improvements due to overly complicated management structures.
We know that there's difficult decisions that need to be made. Planning in the NHS has become very complex. Decisions are taken at national, regional and local level. And what we're calling for is for the Scottish Government to be clearer with NHS boards about their expectations of them in delivering reform, so that NHS boards know the role that they need to play in delivering change. We believe that there's room for greater clarity, and that greater clarity will mean that boards know their own role, that they can focus on delivering improved services for people, and people can get better access to healthcare.
Critics of the Scottish Government say that over the past decade, SNP ministers have repeatedly failed to address problems with the way NHS Scotland operates. But the First Minister today insisted that renewal of the health service is a top priority for him and his team.
I set out earlier on this year the reform agenda for the National Health Service, which is focused heavily on making sure that we take forward preventative interventions so that we reduce demand on our health service, so that we all lead healthier lives, and to make sure that we tackle the issues of access to GP services and reducing waiting times. So all of those elements are central to the scrutiny of the health service that's taken forward by ministers, that's taken forward personally by me as First Minister, by the Health Secretary and by civil servants acting on our behalf.
To reflect on the way our health service operates and ways it can be improved, we're joined from Ayr by the former SNP Health Secretary Alex Neil. And here in the studio we have the health journalist Penny Taylor. Thanks so much for joining us this evening. Penny, you've had a look at the report. What does this tell us about the way the NHS operates?
Well, the Audit Scotland, which is it's Scotland's public spending watchdog, has been pressing the urgent necessity for reform for at least 10 years. And this time it's turned the spotlight on one of the possible blocks to that, which is the reporting structures, the complexity of reporting structures that there are all the way through NHS, and increasingly as social care, it's becoming even more complicated than it was before. Yeah,
I mean, Penny, as you say, this report is about, structural changes that need to be made, but this all comes down to how it affects patients.
Most definitely. I mean, we spend in Scotland almost £22 billion a year on our health and social care sector. More money keeps going in, but it's very obvious that money isn't going to be the fix. There actually has to be systemic change closer to the ground. But actually, this report is also saying at Scottish Government level to create the headspace, to create the room for reform to happen.
OK, Alex, how badly needed is structural change?
Oh, it's very urgent. It has to be part of a much wider programme of reform. But without structural change, you won't get the reform and you won't get the radical nature of the reform that's needed. I mean, I heard John Swinney there saying in your piece that he announced a programme for reform. It doesn't begin to touch the sides of what is required. I mean, the main recommendation coming out of this report today is that you split the function of Director General and the role of Chief Executive. Now, it so happens the current Director General for Health and Social Care is also Director General for Digital Health and Care, which is a separate directorate. So there is no way one person can do those three jobs. And we should certainly have a Director General whose job it is to set the parameters within which the National Health Service should operate. But you should have a Chief Executive, and preferably one with medical training, rather than the non-medical people we have in very senior positions who, in my view, are part of the problem, not part of the solution.
Penny, you wanted to jump in there.
Well, there's a great deal more to running the NHS and social care than, important as they are, simply medics. It's a really complicated job. But this is about scrutiny and accountability all the way through the system. If you haven't got the individuals who can challenge decisions or why they're not being enacted on the ground, then you're going to get a very cosy, comfortable atmosphere, perhaps, where change just doesn't happen. And Audit Scotland is insistent that unless there is quite profound reform, our NHS will not be sustainable or affordable, and that the impact on patients and their families of that is incomprehensible.
What do you make of that, Alex, that we need people that are in a position to challenge decisions that are made?
Well, absolutely. There's no doubt about that. And in fact, we need, I think, more stronger patient input as well as more stronger medical input at the highest level. But if anything, this report actually underestimates the scale of the problem. They talk in particular about the 22 health boards, 14 territorial and 8 specialist health boards. There's also 31 health and social care partnerships. Now, I was involved in setting those up. In my mind, eventually they should have actually taken over from the health boards because the idea was to integrate health and social care. Now, it hasn't actually happened to any great extent. And therefore, a fundamental look at the whole structure and decision-making process, as Penny says, is absolutely essential. Well, let me just give you one example. I remember when I was the health secretary, the size of the board of Greater Glasgow and Clyde Health Board was about 40 people, and everybody and their granny was represented. But actually, having that number of people around the table, far from helping the situation, was making it even more difficult. So it's not just about the number of boards and the relationship. It's actually also about how any boards work. And the boards, in my view, should be cut to around about 3 or 4 and should be strategic in nature, the way the old regional hospital boards used to be. And there should be much more decentralisation and self-management as you go down the line towards GP and primary care, community services and acute services.
What do you make of what Alex is saying there? So this, I mean, it seems incredible that we have 22 boards for a population of 5.4 million.
Yeah.
Cutting that down to 3, would that make a difference?
Well, it's been talked about for decades, and I think this government would say that it's been encouraging boards to cooperate with each other. Well, clearly that's not gone far enough. And it's fine creating organisations like IJB's, Integrated Joint Boards, but what this report lays bare is the poor working that there is on very many of those, where people are in different camps and won't shift. How to change those cultures, I think, is absolutely critical.
And I mean, Alex, creating 3 boards, I mean, how on earth would you do that when change is so difficult to implement within the NHS?
Well, the irony is they already have 3 regional organisations, one for the north of Scotland, one for the east and the west. So they've got this multi-layered organisation at national level, regional level, and then at board level, and then down to GP surgeries and community partnerships and all the rest of it. So you need to look at the whole thing and start to de-layer it as well as streamline it and make it much more effective. But it has to be part of a wider reform programme.
And Alex, do you think there would be the political will by the SNP to do that?
Well, I think we're at the stage, if they don't do anything much more radical than what they've contemplated so far, then the health service is going to be a major issue in any case in the election next year. But I think there are parts of the health service just on the crest of the wave of collapsing, because they're under so much pressure in certain areas. There's a lot of good stuff going on. But at the end of the day, if you look at the waiting list, look at the latest figures, they are very poor indeed, and it's getting worse, better as a whole.
A very serious issue, and it perhaps is a particular challenge as well to this government, which was elected first off, the first time that the SNP kind of took power in Scotland, was basically off the back of saying there would be no reform of the NHS in Scotland. You'll remember that, Alec, yeah?
Yes.
And, hands around hospitals, no change. We knew 20 years ago that change was absolutely necessary. We've pushed it as far as we can. Now it absolutely has to happen.
And the Audit Scotland has been warning the Scottish Government for many years now that change needs to happen. Is the SNP just failed to act, Penny?
Well, I think they've tried to do it in a way that has suited that agenda. However, we've had COVID in between. Our ageing population, which we knew was coming 20 years ago, is now here. It can no longer be ducked.
OK, well, we could carry on talking. It's such a big topic. We will have to leave it there. Alec and Penny, thank you both very much indeed for joining us.
Pleasure.